Good afternoon, everybody. I'm Alan Witchey. I'm the president and CEO here at the Damien Center. I want to thank you for joining us today to talk about an exciting new topic of a new program that's coming to the Damien Center that you may not be aware of, and it's very, very exciting to me. I'm joined today with David Green. David, thank you for joining me today. I appreciate it.
My pleasure.
So you've been here at the Damien Center for a while. Tell me about the role you currently have at the Damien Center.
So currently I'm program manager for a program called Linkage to Care. And what that is we have a team. And essentially we look for people who may have fallen out of care, medical care, whatever. We try to find them. And once we find them, we help them determine what their barriers are, why they're out of care, and help them overcome them, and then get them back into medical care so they can live healthy, long lives.
Yeah, I mean, it's really important because if people aren't stable in care, if they're out of care or they're in and out of care, it's very hard for them to reach viral suppression, right?
Exactly.
And what's the importance of viral suppression for people who might not know?
Oh, well, if you're virally suppressed or undetectable, then you are untransmittable for the HIV virus through sex.
And that's you equals you, right?
You equals you.
And people may see that promotion around sometimes. It's really exciting because we didn't used to know that, right?
We did not know that. And,
yeah.
For people who are HIV positive and have been HIV positive for a long time, it really is a huge relief.
Yeah.
Because it takes away a lot of guilt.
Yeah.
I might be carrying this disease
right.
to others.
Now, back to your program really quick, Linkage to Care. What are some of those key barriers that you encounter with clients when they're not able to stay in care or they might be on the verge of staying in care?
Well, some of the key barriers that, the biggest ones that we've encountered are generally something that's unstable. Homelessness is a big one. When you have no home, you have no place to keep your medications, or you have you're busy looking for a place to stay out of the weather, so you may not be able to make your doctor's appointments, that type of thing, or looking for food, etc. Unemployment is another one, which could lead to homelessness,
right,
etc. And also then substance use. Particularly chaotic substance use, where it might get out of control, and then you may end up in one of those other areas, and getting to your medical provider on time when scheduled does not become as much of the priority. So, and there are a lot of other reasons, but those are the big ones. And
that one sort of substance use or addictions, that's a really important topic that is sort of tied to the program, the new program we're talking about today. And maybe really quickly, you have 2 staff members that are peer recovery coach trained on your team to help with addictions and stuff. Maybe just really quickly, tell us what that means. What does that peer recovery coach mean?
Peer recovery coaching, just very simply, is working with people who may have substance use issues. It's not an abstinence only based model. And again, it's essentially working with the person, helping them to identify whatever they feel that their barriers are in life at that point and then helping them work to overcome those barriers in order to achieve whatever goal that they want to be. To have. It could be at some point, actual abstinence from substance use, or it could just be to be able to get back into their care, or get housing, or whatever, or reunite with family, whatever.
So there's sort of like 2 philosophies in the addictions world, this sort of harm reduction and abstinence based. So do you think that those are competing philosophies? Do they exist together? Is one fits all, or how does that work? Well,
just from my own observation, abstinence only is, that's been around for the longest period of time. In fact, the war on drugs is based on abstinence only. Just say no.
Right.
Don't do it.
Right.
Just don't do it. but that honestly does not work for everybody. It does
Right.
work for some.
Right.
And it's still a lot of work, but a lot of people can do it. But not everybody is able to just stop whatever they're doing. It's very traumatic, particularly if you're using substances that have a major hold and a high addiction threshold, like say opiates
Right.
or heroin, that kind of thing. That is very difficult to really you can't just quit.
Right.
It's your body goes through a lot. So harm reduction, on the other hand, is not condoning you using and things, but it's really, if you are going to use, let's use in a safer way so that you are not putting yourself in danger. You can get to that point of abstinence, down when the time is right.
Right.
But in the meantime, let's make it safe so
Right.
that you are not harming yourself or others unreasonably.
Right. So harm reduction at the core, it doesn't require somebody to immediately quit, but what it does seek to do is to set up safer ways to taper off drugs, right? To potentially stop using your addiction, whatever that may be.
Right.
And that means looking at different things like safe syringe exchange, looking at slow reduction over time, working on something, but still being able to access services, right? I mean, it's about not penalizing somebody who's not able to immediately quit using, right?
Or judge them.
Or judge them, right.
That's a huge, our society, we do tend to judge, because of the war on drugs and,
Right.
and the outlook, and it's all bad and things like that. So harm reduction methods take away the judgment. It's all about safety,
right.
and hopefully a better quality of life, including being engaged in
right.
whatever you need. If it's in the neighborhood, or if it's with a social services agency, going
right.
to the doctor.
Right.
Engagement in life activity is a huge benefit.
And this isn't a new philosophy for us. I mean, we're sort of talking today that we're starting this new harm reduction program, but we've been doing this for some time. For instance, in the housing department, we use the housing first philosophy, and that really talks about the best way to serve somebody who's experiencing housing instability or living on the streets is to get them housed first, get them into a stable situation without requiring them to stop using their addiction, and then to be able to address and work with them on a long-term basis for it. And that leads to great success with housing, right? And we do that in other parts of the agency too. And in your team, you've probably had to do that with the linkage to care many times, where you realize this individual that you're working with just isn't at a place where they can immediately quit, but it's critical for them to get medications for their own health, and as well as you said earlier, it leads to that undetectable, untransmittable.
Right.
Yeah.
Yes, it does.
Now, specifically, this new program that we were funded, the harm reduction, it is looking at safe syringe exchange as part of that harm reduction. It's not just that, right? We are going to be working with people out in the community to help them get addiction resources, get in addictions counseling and support, and get into mental health counseling, and get into medical care and other supports that will help. But it does also allow for that needle exchange. Now, that's kind of controversial for some people, right?
Yes, it is. It's not condoning use,
right?
And it is not encouraging use
right.
at all. But it is maintaining a level of safety, and so that people are able to stay safe.
Right. It's kind of meeting people where they are and helping them, right? And the thing that's really interesting, because I don't think a lot of people realize this, but the research on safe syringe programs, there's a lot of fear associated with it, but the research shows that they actually bring down crime in communities. They bring down overdoses and deaths. They bring down sexually transmitted diseases like HIV. We know that at least 1 in 10 of the people that both test positive for HIV each year and the people that are in care right now, we know at least 1 in 10 have identified getting that through needle sharing with somebody, unsafe needle sharing, right? So this is really like part of this trying to address that one very specific group of people that might need some additional support to help prevent the spread of the disease.
Yes, and not only just HIV, but there's other infectious diseases,
right,
like hepatitis C or cardiology issues that can come along with that type of thing of sharing needles and not having a safe thing. But it really also helps to this is a population that has been in the shadows.
right.
There is a lot of stigma, not only from outside but from inside as well, simply because of social pressures and things like that.
And there's a lot of talk about internal biases in the last year. I mean, we have lots of types of internal biases. And I think, as you said, because of this war on drugs, many of us grew up with this very big philosophy that having the needles present is kind of a negative thing and would lead to more drug use.
Right.
When in fact, what we know is having more needles actually can sometimes lead to less drug use, because it gives you an end to talk to someone, to help them get into care, to help get support that they need.
And I've seen a study actually that shows that people that are in a harm reduction program, particularly with a safe syringe program attached to it, are 5 times more likely to reach abstinence. When
5 times, wow.
When the time is right for them.
Right.
So because they have the support, they
right.
are able, they have and the knowledge.
Right. I mean, that's compelling. 5 times more likely. This is, it's important for people to know this is a best practice, right?
It is.
It's something that works all across the country. There are safe syringe programs or harm reduction programs in every major metropolitan area, and they're working and they're effective. So as we've thought about it, we've really tried to look at what people have done well other places to make sure that we can bring in safety protocols. From what you know, in the state of Indiana, are there a lot of these programs around the state?
In the state of Indiana, the General Assembly granted the counties the ability to have a safe syringe program if they so chose.
So it's county by county.
It's county by county, and there are only a handful of counties that are willing to do it. Marion County is one.
Right.
However, what we're doing is going to be the first non-municipal, non-governmental overseen program in the state of Indiana. So that kind of frees us up a little bit to really take different avenues and different approaches in order to reach people.
Right. Right. I think it's important to sort of make sure people understand that from the State Department of Health, traditionally they fund county health departments to implement harm reduction programs or safe syringe exchange. And we're the first non-county program, non-county based governmental public program to get funded. So that's exciting.
Yes.
On a local level, those county health departments are certainly working with other nonprofits and other programs, so that there are groups that are doing the work with their local county. But we're the first to get funded directly from the State Department of Health, and that's very exciting.
It is exciting. And of course, we do plan to collaborate with our county counterparts and state counterparts. We are by no means going to be an island
Right.
here.
Yes. I mean, it's great because the county has a program already and we already collaborate with them, right? So they come on site and we work with them. And this will give us a chance to work closer with that team and to help the people that they serve in more intentional ways and help reduce some of the barriers. Because I know talking to that team, sometimes they find it difficult to help their clients get some of the care that they need. And we'll be able to help do that a little bit more with them.
Yes.
That's exciting. And will we work with other community-based partners, or is this something we're just going to do on our own?
No, actually, we are going to be working with other community-based partners. One major partner in particular is called the Never Alone Project.
Yeah.
And they are also a harm reduction nonprofit. They have started out as a grassroots kind of organization. They have gained more status and things like that. And they are already kind of out there. They already know what the landscape is like. So we're not going in here totally blind. We're not trying to reinvent a wheel or say that our way is right. We're going to work very closely with them, and they'll actually guide us through, especially when we get to places, because this is brand new to us.
Right.
You know, a lot. This is uncharted water.
Yeah.
In many ways. So yeah, we have a lot of help, and so I'm feeling very confident about it.
Good. I'm very excited because it's actually creating new partnerships and new collaborations for us too, in significant ways. So right now we are in a process of hiring people for this program, right? So we're going to have 2 new staff. One's going to be doing more case management oriented stuff, and one's going to be more of a going back a little bit probably to that peer outreach and connection model that we were talking about at the beginning, where we talked about that peer recovery model, and they'll both be able to do some of that work, right?
Right, and we'll definitely be in the thick of it all. We'll be meeting people where they are. That would require, you know, going out to wherever that may be out in the world. And also we'll have availability here in-house for that kind of thing. We'll have, you know, they'll provide counseling if the client wants counseling, referral services to whatever their needs may be as best we can. So we'll be providing as full services as possible because they deserve to have these services.
Yeah. Well, it's about treating everybody like a human being and getting help when they need it the most, right? I mean, I think that's what we're trying to do as a Damien Center, without judgment, to help anybody who needs it when they need it the most and to help them get back on track and the life they want, they need. So I'm very excited about this. We'll have to come back to this discussion in a little while, maybe a few months, 6 months or a year, and see how it's gone and talk about the successes. So we'll see. In the meanwhile, it's hard to know. Sometimes people want to know, can I get involved in a program? Is there a way for me to volunteer with that? And the best thing I always tell people is to go to our website. We do have volunteer opportunities listed there, and they can log in, and we have a great volunteer manager. They can reach out to her and ask for opportunities. Right now, we don't really know, right, if there's going to be opportunities with this, right?
We don't know yet.
Yeah, it's early.
A lot of questions.
Yeah, well, good. Well, David, I want to thank you for joining me today. It was great to have this conversation, and very exciting stuff happening here. Just one of several new initiatives happening at the Damien Center. We are part of an initiative to end the epidemic, and ending the epidemic. You're very invested in this program. Do you want to share just really quickly, what is that?
Well, Ending the Epidemic is actually a federal program.
Right.
Indianapolis is one of the main areas that the initial phase, first 5 year, it's a 10-year program. First 5 years is going to be, Indianapolis is one of the areas.
One of the 48 top hotspots in the country.
Hotspots,
yes.
Where out of all of the 48 hotspots, 50% of all new infections have come from for HIV. So, we are here, been asked to come up with new plans, new models, and prevention is a huge part of ending the epidemic. If people are not HIV positive, then eventually nobody will be.
Right, exactly.
And so,
And this is part of our ending the epidemic strategy.
and this is part of it.
Absolutely.
Yes,
Yep. Well, I want to thank everybody for tuning in today. As always, we appreciate your support and your interest. We can't do the work that we do without you and your support. So please consider going to our website. That's Damien, DAMIEN.org. And there you can make a donation and support us. You can volunteer. You can learn other ways to engage with us and share your talents and your skills. I do appreciate your support, and please don't hesitate to reach out to me. Thanks very much. Have a great day.